So, thank everyone for coming, and thanks for the folks online live and those watching it if you're watching it recorded, you don't get the benefit of knowing that tomorrow at noon there will be a rally to share your thoughts on Medicaid, and that'll be up at the Capitol by the flags. For a large group of people, that'll be it. So I'm David Carlson, the executive director here at Disability Rights Montana, and we have collected a lot of folks who are smarter than all of us about Medicaid, so they can talk to us a little bit about what's at stake with Medicaid expansion, what it does for our state. And I will let everyone introduce themselves, and then we've got some questions. But if you have a question from the audience that we are not answering, let us know. And we will hope to finish around the top of the hour. So for those online, that's about 45 minutes. So thank you again for attending here and online.
Great. Thank you so much. I'm Heather O'Loughlin. I'm the Executive Director for the Montana Budget and Policy Center. Montana Budget and Policy Center focuses on how public policies impact low and moderate income families in Montana. We've been working on Medicaid expansion since really the very beginning, since 2013, and really excited to be here with everybody.
Tanse Kiwa, Nuako Mugtik, Tumskat Noa, Joel Zed, Rocky Boy, member of the Chippewa tribe. I am the CEO of Rocky Boy Health Center, which is an entity of the Chippewa tribe. We've been serving community for over 50 years. We started out as a small clinic. We took over services from the IHS in 1994, so we're a self-governance tribe, one of the tribes that administer their own services within the state. I guess we have a heavy Medicaid expansion population we serve. Daily we probably see over 500 patients, about 5,000 total for our service unit. Number of services. I'll get more into it when we start talking, but really we do everything we possibly can as a clinic there in Rocky Boy, North Central Montana. For those of you that never go north of Great Falls, it's about 85 miles north, about 22 miles south of Havre, so it's rural. It's pretty cold there too. It's nice. Happy to be here.
Thanks. Olivia Ryuta. I'm with the Montana Primary Care Association. And the Primary Care Association is the membership association of all of the across the state of Montana, and also the 5 urban Indian organizations. Here in Helena, that's Pureview Health Center. And provide comprehensive primary care services, right? So we're thinking about how do you see kind of a traditional nurse practitioner or doctor, but how are we integrating behavioral health, dental, pharmacy, and then really the piece of the work that I work on is how are we screening and understanding how the people in our communities have both complex health, but also social needs. So we're screening for social drivers of health. We are helping folks enroll in health insurance coverage when they don't have it. So we have done that work, I don't know for how long, but there's about 120,000 Montanans that we serve through our members. In addition, we have a program called Cover Montana. And I think I'm here a little bit because I spend most of my days really deep in the process, especially around Medicaid eligibility. And so we have a federal navigator grant and spend time helping folks apply for health insurance coverage options and have been really quite busy. Open enrollment ends tomorrow. But we've also been quite busy during the Medicaid redetermination process that's been happening that started in April of 2023, and we continue to kind of feel the impacts of. So, and I'm based out of Missoula.
Great. Well, thank you all. We can start down there with you, Olivia, and work our way back. So from a real high level, how would the loss of Medicaid expansion impact services outcomes for Montana, both individuals and communities?
Absolutely. So we, like Heather, I have had the privilege of working on Medicaid for a long time, and so did this kind of outreach and enrollment work pre-expansion. And so, what I can speak to, uh, really for individuals, right? Um, it Medicaid expansion is a game changer in terms of their ability to access comprehensive services, right? Without Medicaid, folks might be able to go to a community health center, they might be able to go to an urban Indian organization, they might be able to get on the charity care program at a local hospital, but to be able to receive kind of consistent services, get all of the referrals you need, be able to afford all of your medications, it's really a game changer, for people's ability to do that. So, we care about people, right? So it impacts people, and folks are gonna go to the doctor whether they have health insurance coverage or not. They're gonna go less and not at the best time. They're gonna delay care, but it allows us to serve people in a comprehensive way. My favorite folks to listen to are actually listening to healthcare providers to talk about what it's like to sit with a patient and say, "Okay, I'm a trained physician and I'm spending my day thinking about, okay, well, we can't do this route, we have to do this route," right? To really just be able to provide treatment for the folks and give them the referrals they need, knowing that those folks can make that referral. So for healthcare, it really means that we're gonna continue to see folks who are not going to be able to, they're not gonna be insured, and so we're gonna spend a whole bunch of time trying to figure out how to get them as much as we can. Obviously, there's a big financial piece of that. I think Joel can probably speak to that more closely because, look, in terms of your patient population, what you've seen.
Yeah, and just so the audience is aware, I think IHS funds, tribes, and each tribe's different based on population, but usually it's about $4,000 per patient per year. It's pretty low, so whatever money we get, it's not doesn't go very far. So it's really upon us to have these multiple buckets just to expand those services. That's what we've been able to do. Prior to, Medicaid expansion, the preventative care did not happen. So if you needed to get your, David, if you needed to get your knee replaced, I mean, you're on the list, but the people with higher ratings, so we had ratings level ones, yours would be a level 4. You wouldn't get that done unless there was money at the end of the fiscal year. So having that Medicaid expansion has been allowed that preventative work to take place, which would never have happened. We were seeing mammograms being done. We just had them recently with Northern Montana Hospital. Beautiful. We got a lot of them done in one. Previously, that did not happen. We'd wait for the bus wouldn't show, or the van would not show up. We'd have these scheduling issues. Women just wouldn't get those services. The other one would be colonoscopy. That was difficult for our membership to get. Now, with Medicaid expansion, we're seeing all this work. We've really been able to move upstream with some of these and really have an impact in our community because that's what it's about is building have an impact on our membership, having a healthier life, having access to the best service, not have to travel so far too. From Box Elder or Rocky Boy for May to Great Falls, it's 100 miles. Uh, so when we get those people out there, we're transporting those that come through. So that's a big thing about rural Montana. Everybody thinks it's Billings, it's Helena, or we could just go down the road. It's not like that. And they got to go to Havre too. Not everybody gets to leave the reservation, go to Havre, 25 miles. So I think allowing this Medicaid expansion is just allowed us to just push this.
That transportation issue is super important. The disability community has a very high rate of non-drivers in our community, whether it's because of a condition that impacts driving or it's just the amount of money it costs to have reliable transportation to get to then the healthcare and the rest that you need. I I really heard what you were saying about the people need to together, find the services that they need. If they can't pay for it, we're looking at another option, another option. I just uh, brought my son to a doctor's appointment today, and we were leaving, and he asked, "When you're at my age, he got a new medication. Do you have this medicine?" I was your age, we didn't have health insurance, so no, didn't have that medication. So it is a very different world seeing when you have access and when you don't have access, and both the preventative care and the stuff that's lower level than going to the emergency room and maybe qualify for charity care. Because I was born with a heart condition, so I was always have a heart attack. But most things short of that, not so much. So maybe we could move to unpacking a little bit of what makes Medicaid expansion different than traditional Medicaid, just for folks who maybe aren't familiar of who would be accessing Medicaid insurance through the expansion.
Sure, I can start, and Olivia should jump in. So in Montana, traditional Medicaid covers children who are eligible by their household income, people with disabilities, seniors who qualify due to low incomes or other criteria, and then um, traditional Medicaid covers a small percentage of adults um, who are parents living on very low incomes. So when Congress passed the Affordable Care Act, it expanded who was eligible for Medicaid, and that is coverage for adults up to 138% of the federal poverty line. That's about $20,000 for a single individual, or about 35,000 for a family of three. So it's a very good question, and I think it's like something that's important to emphasize when we talk about Medicaid expansion and what we have up at the legislature this legislative session. It is for those who are on Medicaid expansion. So I think there's been a lot of questions of what does this mean for my coverage for my child, or if I'm on traditional Medicaid. What the legislature is considering is not impacting traditional Medicaid. There are about 218,000 folks on Medicaid as a whole. About 76,000 of them are on Medicaid expansion. So it is a pretty significant population, and the decision by the legislature is going to directly impact those 76,000 Montanans. Do that and think
differences also in the process, right, and how you apply is a little bit different. And so for folks who are on expanded Medicaid, right, we're really looking at earned income, which I think is an important distinction. And then what we see a lot in our kind of enrollment work is if anybody has gone through the uh, process of applying for disability, right, it is not easy. It is a complicated process. Um, and so there are a lot of folks who um, might not have a Social Security disability distinction, but are really accessing expanded Medicaid to get the health care that they need. And I think so we see that a ton in the work that we do. And it really it's just there is much more access, and that process is much simpler for folks who need healthcare now and might have a disability, and don't need to or don't have to go through that full process, because now they can get it through expansion.
Um, Thank you. I think that's really helpful. Those figures about um, 20,000, 33,000, 33 for a family of three in Montana with our housing costs, our food costs, what it costs to raise kids. We're not talking about people who are gaming the system and they're sitting in large mansions with 100,000 plus incomes. And we often talk about um, should there be work requirements for Medicaid? We we know what that looks like because they don't
We bring a lot of specialty care out there. We bring a cardiologist, nephrologist. So also with the providers outside services not being able to have ripple effect. We won't get those. That is allowed. When we were talking about dollars, did I mention that? So what happens is whenever the IHS or travel unit, whenever we can't do services within our building, we send our travel members to for that special. That's called purchase. Cover that. Through Medicaid expansion, it's allowed us to have all these different providers. Being able to have the folks those extra services. A lot of that will go away. We didn't have that prior.
So, pediatrics, obstetrics, cardiology seem like important things. They also seem like they're delivered by cardiologists, obstetricians, pediatricians. These are human beings. Um, and who wants to talk about the economic implications of Medicaid expansion on the economy, including job creation, tax savings, healthcare costs? Because people who are delivering healthcare in Montana pay for housing in Montana, they pay taxes in Montana, they pay for groceries in Montana. That money stays here. So, um, any any thoughts on what would happen if we get rid of the Medicaid expansion dollars, not just to the healthcare providers, but then to Montana more broadly?
Yeah. Well, for us, we have 200, employees in Central Montana. That's a pretty big deal. With population base and the amount of resources that go out. So we put millions of dollars into not only our community, but Havre. A lot of our folks live in Havre, which is 25 miles away. They're homeowners, live and work in that community as well. So I think there's a huge impact that we see that would negatively affect our community. Ours, we've been able to add that workforce over the last 10 years from the Medicaid.
Yeah, I mean Joel has the like on the ground, which is so important, exactly what it means. I'll give you kind of just like the big number. Because Medicaid expansion is 90% federally funded, it is a significant injection in federal funds. It represents something like $900 million, almost $1 billion into the Montana economy every year. So it is a significant driver of the state economy. Um, it has created and sustained jobs in Montana. Those are a lot of healthcare jobs, but a lot of other jobs, David, as you mentioned. And that has a significant ripple effect, and particularly I think in rural communities. We have seen Medicaid expansion really help keep rural hospitals open, and uh, be a driver for economic activity. So it's it's hard to really kind of put it into context how significant Medicaid expansion has been for the economy.
Well, I guess then to loop back in there and to emphasize, if it has such a big economic impact, um, one might think, well, that's because it costs Montana a ton of money to do this. So I wanted to loop back to a percentage you threw out there, and could you talk about what it costs Montana versus what we get? Because if I invest in the stock market, I'm happy to get 8% return over year over year over 10 years. Or if I invest in a home and it goes up in value, 8% a year seems like a great amount. Some years we see outrageous increases and sometimes decreases. But what kind of return on investment does Montana get with Medicaid expansion?
Yeah, I mean, so I mentioned that the program is 90% funded by federal funds. So Montana is putting in a 10% of the total cost. That compares to, um, even highway dollars, like the state puts in more dollars to match federal highway funds. So it is a substantial match by federal funds. Um, I think that the other thing that's important is that the state, by investing those dollars into Medicaid expansion, has seen savings in other areas. So we have seen savings in Department of Corrections because the, the state has a legal obligation to provide healthcare services for those who are in custody by the state. Um, those individuals are enrolled in Medicaid, and we're able to bill Medicaid for that. They're a subset of the population that were accessing Medicaid through traditional, which is a lower match, who were able to transfer over to Medicaid expansion. The state has seen savings with that. So there's been substantial savings on top of the federal funds. So it has been a very good deal for Montana, um, and I think that, all of the specific examples of what we've seen in communities, like, that is just um, a ripple effect through through the program.
I was just going to comment for the federal government actually pays 100% for tribal that for services administered through a IHS facility or a tribal. So it's 100%. So pretty good deal for the state, right? And then we go out there and spend money. I mean, if we're in business, economics, then our money is turning over there in these other communities as well. So we're a part of that. We're a driver of that. The other one I wanted to say was uncompensated care, because prior when nobody had the Medicaid, they were walking into ERs, especially in our area. We don't have an urgent care, so that ER fills up really quick without people without that coverage. This has allowed them to drop that uncompensated care. It's been a big benefit. That I think getting the true number on that, I think if you just talk to some of the hospitals, they'll tell you big deals.
And yeah, it is a good deal. I don't know of anything else in the world that gives you 900% return on your investment. So there's not a whole lot to improve on the economic side there. So I'm interested in, how does Medicaid expansion help with addressing health disparities? We know that not everybody gets equal access to health care. If you are a rich middle-aged white guy, you look like me, you wear jackets, not as rich as many people in Montana, but I have insurance through work. I have enough money for the copays. I have enough money for the premiums. And all scientific studies are designed around people who look and act like me. Um, I get better health care than if I were a woman, if I were transgender, if I were disabled, if I were a person of color, or if I were indigenous. So, uh, could you talk at how Medicaid expansion addresses that or interplays with that health?
Sure. I guess for some of the folks here that maybe aren't aware, us tribal communities, you name it, we're the highest in diabetes, cancer rate, life expectancy, all these different types of factors. And through Medicaid expansion, we've really seen our cancer rate go up, which you think that's a bad thing. No, it's because we've been able to do these preventative screenings. Previously, what was happening is people would get screened and they're already stage 4, and then that's it. So, to be able to do these types of things has really helped. I don't think we'll actually see the good data till another 10 years of Medicaid expansion, though. To really cut into what we faced through underfunding, through IHS, it's going to take a little while for the numbers to weigh out. But I think Medicaid expansion has really pushed us to get with your health care. And that's what we try to give to our membership, is to make sure that they have the best health care. If they need to be, I mean, we got cataracts, we're getting uh, hearing aids for our membership, all these things that never happen. They're living a healthier, more for healthcare, having those options. So previously it wasn't. But I feel like it's really that, but I won't see those numbers further down the road. I also want to say for rural populations, we talked about it. Transportation that's allowed those things to come to our region to have the better healthcare. Previously they weren't there. However, I think of folks out east as well, where you got a long ways to go to providers. Be able to see them now and be in those communities, these critical access small clinics, now to be able to have that better access, now that it puts us rural in with telling us how to be able to have those.
Um, I think, I mean, it's all about access, right? And getting access. I mean, Joel said it, getting access early so that you're doing that prevention work, right? I think with Medicaid, expanded Medicaid, we think about parents, right? So kids have coverage, but what happens if your parents don't have coverage, right? Can your parent go to work? Can they take care of you in the same way? Are you getting well child visits in the same way? If you need kind of behavioral health as a family, can everybody in the family participate? Um, I think that what we see a lot is like previously, before we expanded Medicaid, we would see folks who were, you know, 58 and just desperately hoping they didn't get sick before they could enroll in Medicare. And it's a real game changer to be able to preventive services. So it's really getting people in. And just one, this idea of vulnerable populations, um, rural folks are very vulnerable, right? They historically have higher rates of being uninsured. They have to travel much further for services. Um, and so it's certainly helping those kind of low and moderate income folks in rural communities, but it's helping everybody in rural communities, right? If you are in if you I live in Missoula, if you're in the Bitterroot, right, and you've had insurance your whole life, you're getting better access. Getting access to more services because your neighbors have insurance and they get it through Medicaid. And so those providers, those healthcare organizations are able to offer more services that certainly help folks enrolled in Medicaid, but certainly help folks who are getting their coverage through an employer or through a parent, that sort of thing. And so um, I think that we have lots of, I know there's Bryce Ward does some really great research on the economic impact and we can compare states that have Medicaid. We can look at states that haven't expanded Medicaid, but we can also remember, right? And I think that we remember what it was like for folks um, who were in kind of this income bracket because it wasn't all that long ago that we expanded Medicaid. It's made a huge difference, but we can remember what it was like for them. Certainly in our work. I would just other.
Well, then I'd like to wrap up with the last uh, uh, planned question, but I'm saying this to prime the audience. If you have any questions before we wrap that you want to talk to these experts about, get those ready in your head. But I'd I think it'd be helpful for folks here, folks at home, to think about what do you think are the most effective strategies for advocates, policymakers to ensure that Medicaid expansion remains a legislative priority in Montana. So, what can people do to help us access that 900% return on investment, access cardiologists in communities that wouldn't have enough money to have a cardiologist in their community if not for this money, access uh, the dollars that are spent by those individuals when they are living their lives in rural communities, and access good healthcare. How can we help the legislature understand what we value?
Yeah, well, I'll start. I think, I think often about the work that happened before I started MBPC and really the driving force of passage in 2015, and it really was individuals sharing their stories. Um, there were I still know every single one of their names. I know exactly what their stories were, and I can guarantee that the legislators that were there that voted in support of Medicaid expansion in 2015 know those stories too. So I think the extent to which individuals have a personal story about what access to healthcare coverage. Maybe you were on Medicaid expansion, maybe you are still on Medicaid expansion. There's a lot of different ways to share that story. The Healthy Montana website is a great place to go to do that. It's healthymontana.org. And there is a way that you can connect with the folks who are really helping to talk with individuals about what it means and what it looks like to share a story. And that can be with your legislator, it can be just helping to kind of provide some perspective on what the program has meant. So I think that's a big part of it. Um, David, you mentioned at the start of this, there is a rally that is happening tomorrow at noon at the Capitol steps. If there are folks who are able to come to that, that would be great. I think it's a really good opportunity to show legislators that there is broad support for this program in Montana. Um, there will be warm beverages, there will be T-shirts, Medicaid T-shirts, and a lot of, I think, just excitement for continuing to push to renew the program. Um, I wanted to share just the two bill numbers that I think for folks that may be interested in what is the bill? Where is it headed? So Representative Buttrey, Ed Buttrey, who carried the bill in 2015 and the renewal in 2019, will carry the bill again this session. Right now, it is still in draft form, but if to find it on the legislative website, it's LC 0953. Representative Mary Cafaro will also be carrying a bill that will lift the sunset on Medicaid expansion, as well as propose a number of positive reforms to the Medicaid program. Those changes are focused on really improving people's access to Medicaid, which Olivia and Joel, we all could probably talk about that for a whole nother hour tonight if you wanted. But that bill is LC 1217, and both of those bills will be heard in the House in committee. And we anticipate that those hearings may be scheduled here in the next week or two. And so I think if folks are interested in engaging with their legislator, testifying in support of those bills, I think that is great. But those are kind of some of the main things. But maybe I'll just see. What else would you share?
Well, I, I think just making a point to, it's like leadership. Everybody deserves good leadership to be led well. And I think with healthcare, everybody deserves healthcare despite where they're at in their journey, whether they're rich, poor, going through transition, divorce, whatever it may be. I think by having Medicaid expansion, it's just good for Montana, right? been good. We've seen the ripple effects. So if we're out there talking to these legislators, I mean, if you look at the numbers, if we throw out philosophies, whether you're a Bobcat, Grizz, or a Democrat, Republican, whatever it may be, it's about people and people having access to health. And that's still hard because people want to bring in these philosophies and all these different things. And I think too is the people that are on Medicaid are not, they're working people. I mean, I have a story. We had two working folks in the service industry. The kids are all on Medicaid. They didn't qualify. They didn't qualify to be on Medicaid. They couldn't pay their premiums for their work. I mean, it's those types of situations we see all the time. And by having that Medicaid expansion, it's been for all of our service industry, that wouldn't happen. And as you see, Montana, it's changing, right? We need people in the service industry. Not everybody, and these ranch hands, they need it as well. Farm hands, all these different folks. So I think the numbers and the economics all make sense. So let's make sure that everybody has that access to affordable healthcare.
Um, Heather took I was going to say stories. Just kidding. If you do have questions about stories, we can talk way more about stories. It's my favorite thing to talk about. So I think the beautiful thing about Medicaid and continuing Montana's Medicaid program as we know it is that it strengthens communities. It strengthens communities across the state here in Helena, all the way up to Northwest Montana to Southeast Montana and everywhere in between. And everybody in all those places has someone who represents them in the House and someone who represents them in the Senate. And so I think to just remind folks that they have a person there who is supposed to be really representing their constituents, and for those legislators to know that that's how their constituents feel, that it isn't those other people, it isn't some other place, that Medicaid is important to people in every single district across the state, and is strengthening people's ability, it's strengthening people, their ability to access care, and it's strengthening their communities by making sure that our neighbors have insurance and can go to the doctor when they're sick. And I will just say, if you've ever spent time in that building, it is so fun to have folks, right, call early and call often, I would say, and light up the Capitol switchboard, right? It is fun to see the little messages on people's desks. And I would say call and ask people, don't assume anybody's going to vote anyway, right? I think you'd be surprised. Let's ask people to support this program that we know is important for our communities. And then let's thank them when they do. I would also say that sometimes we spend a lot of time getting calls in. We also need to thank them when they vote the way that we think that they should vote. So I would say don't be shy. And we have, if you're in Helena, you have lots of access to them. So, um, which is also a wonderful thing. So I would say stories and really making sure that they know who we are. As Brian said, it's important to be the squeaky wheel and to just be that. It's just 90 days, right? It's not every year. It's just 90 days. So really trying to pay attention and track that and reach out as much as we can. So they know that we're listening and paying attention. This is a really important policy issue for us and our communities.
Well, thank you. I think stories are really important, and everyone has one. So, and you are the expert in your story. There's no one who's going to swoop in and say, "You didn't get that mammography test done. You didn't get the cardiological echogram done." It's like, no, it's your story. Explain how you benefit. Explain what you think needs to be done in Montana. That carries a lot of weight because there are very few issues that have as good a stories as access to good health care. That because the alternative is a life in a community is much harder to live in. So we need to share the stories of it wasn't that long ago when people didn't have access. This is what it was like then, and this is what it's like now. Why would we give that up to save 10 cents on the dollar? So I'm gonna throw it out there. If you have a question, please let me know. I can't run to you with the mic, but I will repeat the question for everyone else in the room and for folks online. Yeah, Brian. Thank you. Yeah, Montana doesn't need less healthcare. We need more healthcare. So fighting every couple of years to keep what we have seems like a lot of work. Yeah. The question, can we talk a little bit about the background in 2019?
Sure. Yeah. So Montana first expanded Medicaid in 2015. That 2015 law included a termination or a sunset clause, and so the legislature had to come back in 2019 to renew the program. They did that on a bipartisan basis. Um, they included another termination or sunset clause. So appreciate Brian's comment. I think the goal of everyone is to lift the sunset and continue Medicaid expansion in Montana. Um, Representative Buttry and both Representative Cafaro support that, and both of their bills will do a clean lift the sunset. Um, but that's yeah. So in 2019, we had to sort of do it all over again in order to continue the program, and that's where we're at right now. Sorry. I also appreciate Brian's comment about behavioral health, and I'm sure that you all both have comments on this. I think that this is a really important tie. There is a lot of interest in the legislature and with the governor's office around investments in behavioral health. And I think advocates and individuals have been really good about connecting that to Medicaid expansion. If we eliminate Medicaid expansion, all of the work around the Behavioral Health for Future Generations Commission, the heart waiver, all of these efforts are really not going to work if we don't have Medicaid expansion and that sort of infrastructure in place. And so I do think that's a really important thing that it is a driver in a lot of these conversations with policymakers. And I don't know if either of you would want to add anything to that.
I mean, it's just Medicaid expansion underpins all of this, like great and exciting, and I mean, truly exciting work, right? But we have to, we're building up, and Medicaid expansion underpins all of that work. And so I think it's exciting. I think I'm hopeful, right, that there's a lot of interest in behavioral health and that we get to have some really good conversations about the importance of Medicaid or behavioral health and who it's currently serving today, who's getting behavioral health services today because we've expanded Medicaid.
Yeah. Sure. The question was, can we share the number for the switchboard so that people here and online can access that? And absolutely, we can. 444 3064. Is that correct? All right. 444 4800 4800. Yes. All right. And there you can let them know, hey, I'm from Haver. Can you send a message to my people? Or I want to reach the people on this committee. Can you help me reach those? And you can leave a message for them. So they know who everybody is, and they can help you out there. Yeah.
So there is a new system. It is not the law. It's not the law. So there's a new bill tracking system, right? Which is laws is what you're probably used to. So if you go to legmt.gov, it looks a little different. So I would say if you're gonna listen, if you're excited to listen to a hearing, go there 5 minutes before so you can kind of find the right place. So there still is on legmt.gov the ability um, to search for bills by the sponsor, or by the content, by keywords, that sort of thing. So you can still track and see the bills. So the short answer is yes, but it is a new system, and so it might take you a minute to kind of get acquainted.
Also, it's a little bit like those old books, Where's Waldo? You do need to look for, it's not really obvious where the bill tracker is. But keep looking, it's there. All right. Any questions online? We get anything? All right. Well, very rarely do I actually follow through on my promise to keep us on time. And this is one of those times when I did. So thank you all for coming. Thank you online for viewing, and those viewing asynchronously. Thank you. And tune in for the next one. If you're online or here in person, next week we will be talking about supported decision making. The week after that, transportation every Tuesday night during the legislative session at a minimum. But if people like it, we'll just keep doing it. And like I said, if you're asynchronous, just look somewhere. There'll be a playlist, and you can see community conversations on a variety of issues coming up. So, thank you all.